And next we'll hear from Netia McCray, a constituent of mine and a member of the COVID-19 Long Hauler Advocacy Project.
Thank you, Representative, and thank you all for joining us today. Sometimes they come and go, these symptoms. So as mentioned, my name is Netia McCray. I'm the executive director of a STEM nonprofit called Vajika and a proud Roxbury resident. And I'm here today as an advocate for the C-19 Long Hauler Advocacy Project. First, thank you for this act and listening to our voices crafting this piece of legislation. I have to say, for years, the voices of those suffering from post-infectious disease have been unheard by our representatives, and we've had to wage our battles to survive in silence. So I want to say thank you to start off. Second, I want to go back 2 years ago when I woke up and I felt extreme tightness in my chest and a migraine, which left me on a bathroom floor, short of breath, and the room spinning. When I reached out to my doctor, I was told, if you can talk, you're fine. In a few short months, I went from a healthy, independent woman to someone requiring a 24/7 caretaker who happened to be my mother, who's also suffering from post-infectious disease. The inability to do simple math, the confusion, the short-term memory loss, the seizures, down to the microclots that are responsible for my heart attack have become my long-term COVID-19 symptoms. For 18 months, I attempted to figure out what was happening to my body and what had robbed me of my dream career serving my community. An ER visit, 5 primary care visits, and 5 specialist visits later, all I received was a recommendation to take a Tylenol, an adult coloring book, and yoga. It took 18 months before I was able to access testing that proved my initial PCR was a false negative, likely due to timing, and to receive a post-acute COVID-19 diagnosis. My mild infection should have landed me in the hospital. It did not. Monday was my 2-year anniversary, much like Senator Kane, from suffering from COVID-19. 24 months later, I'm still encountering individuals and medical professionals who believe mild COVID cases do not lead to severe consequences, or if you didn't have a positive test, you didn't have COVID. And I'm proof that's not true. To quote once again the late Bell Hooks, sustained grief is particularly disturbing in a culture that offers a quick fix for any pain. The realization that there is no quick fix is why it took so long for us to arrive at this realization that there are long consequences to COVID. My medical treatment and loss of income thus far is well over $100,000, including about $3,000 a month in seizure medication, and that's with insurance. Why? Because long COVID treatment that I am going through is not considered a COVID-19 treatment. This is inaccessible to the majority of Americans, let alone my community, who are largely insured due to limited income or loss of employment, and because we live in a healthcare desert. Even access to an appropriate clinic or a healthcare professional who is aware of post-infectious diseases like long COVID, ME, MCAS, let alone treatment options, is rare. Given the estimated 8 to 24 million Americans suffering with long COVID, forcing patients to treat serious physiological health issues with Tylenol, positive thinking, and yoga is no longer an option. That is why the Treat Long COVID Act is so critical at this point in time. We need the Treat Long COVID Act in order to provide and expand that multidisciplinary long COVID care to communities like mine, regardless of their location, the method of diagnosis, their insurance, or previous health conditions. As we urgently return to normal, it is my hope that the Treat Long COVID Act will help myself and millions of others return to our normal after shouldering the burden of this pandemic. So once again, I say thank you for pulling together all these resources to make this a reality.
Netia, thank you so much. And I'm as deeply impacted by your words now as I was at our initial roundtable in January. Thank you for sharing your story, your pain. Thank you for your impassioned plea for urgency in this moment. And thank you for your partnership in the crafting of this legislation.